The 28th of September marks International Safe Abortion Day, a day of action to support access to safe abortions and reproductive health services for women and girls. The South African Constitution allows abortion on request during the first 12 weeks of pregnancy and beyond 13 weeks in the case of medical, physical, or mental risk or fetal abnormality. Even with these legal provisions, illegal and unsafe abortions persist in the community, often fueled by shame and stigma, and sometimes even at the expense of concealing criminal activity. Let's discuss why this day is important with obstetrician, gynecologist Dr Koketso Pule. Good morning. Welcome to Newzroom Afrika. Thank you for your time.
Good morning, and thank you for having me. And I appreciate you shining a light on such an important and sensitive topic.
And could you give us some context around International Abortion Day?
So International Safe Abortion Day seeks to advocate for safe and legal abortions, especially in low, middle income settings. Unsafe abortions account for about 45% of unsafe abortions that can lead to, as estimated by the World Health Organization, it can lead to 13% of preventable maternal deaths.
What does that mean?
It means that unsafe abortions and limited access puts the life of women and girls under threat. So the issue is mostly advocacy and the stigma that surrounds the termination of unwanted pregnancies. So these deaths are often preventable, and 13% is a lot in terms of maternal health. And this speaks to our WHO developmental goals to essentially reduce maternal mortalities. If 45% of abortions are unsafe globally, leading to maternal deaths, our legal system needs to be more vocal about sexual and reproductive health rights for women, and to advocate for safe abortions and to promote access to safe healthcare.
Yeah. Doctor, how prevalent is or are abortions, particularly in South Africa? It's a very contentious issue, you know,
Yes.
because we as a country don't even have a legal minimum age, which brings the contentiousness into the conversation.
Yes, so abortions are common because of our society with the rife statistics of GBV, rape, incest that engulfs our communities. So there are a lot of unwanted pregnancies or pregnancies that are deemed to either have a threat on a woman's life. So if a woman has a medical condition and it's deemed unsafe for her to be pregnant, or if a woman falls pregnant and then whatever disease process she has worsens during pregnancy, a medical termination may be advocated.
What sorts of medical conditions could warrant an abortion?
Some medical conditions, for instance, if someone has uncontrolled hypertension with renal disease that can progress during a pregnancy, a woman who has heart conditions, because a pregnancy will change your physiological state and make your heart work harder, and it can worsen these heart conditions. It can worsen kidney disease. Some people live with autoimmune diseases like lupus. So pregnancy can worsen some of these disease processes. And if it comes to a point where the pregnancy is posing a threat to a woman's life or health, then a medical professional can advocate for the termination of the pregnancy to essentially save the woman's life.
Doctor, you spoke about stigma.
Yes.
Let's talk about accessing public health facilities, especially for young girls.
Yeah. So the access to healthcare facilities could be better. The stigma around safe termination limits this access, but mostly it could be attributed to the lack of education or misinformation, and us really not being able to provide those safe spaces for young girls, and providing platforms that educate and empower and train healthcare professionals, nurses as well, and healthcare professionals that can assist in offering this service.
So one of the biggest issues, which is, I mean, very contentious, as I'd indicated in the beginning, is the fact that there's no legal minimum age for girls to access abortion services in facilities, whether public or whatsoever. So how do we protect our girls in the case of criminal activity? For instance, a 12-year-old I don't think a 12-year-old should be able to access abortion facilities without the consent of their parent. But, you know, how do we protect them in the event that that happens?
So we have the Children's Act that prescribes to us in terms of the legal framework. So a healthcare professional, first and foremost, is obligated to report a criminal offense if a 12-year-old presents pregnant. So it's an obligation for a healthcare professional who encounters a 12-year-old who's pregnant to report it to the police, to report it to social workers so that it be investigated and criminal charges be investigated or charged upon the perpetrator. So this is at 12 years old. The Children's Act as well then speaks to the age gap violation where a child between 12 and 15 can have consented sexual intercourse with someone not older than 2 years within that age gap, right? So our legal system, it becomes complicated in that because then statutory rape is then at the age of 16, but a child between 12 and 15 can consent to having sexual intercourse with someone who is 2 years,
not more than 2 years
older.
This conversation needs an hour.
It does, it does.
But thank you so much for providing clarity
yes,
because we have to wrap it up.
No problem.
And thank you so much for your time.